This is Sherry, and my presentation for you folks is on specialty certifications for family nurse practitioners. So I decided to focus on the certifications that we can pursue after graduation and after we certify as FNPs and move further into our careers. For the vast majority of the certifications that I'm going to discuss today, you do have to have some time under your belt practicing in that specialty before you can move on to earn your certification. So, I'm just having a little bit of technical difficulties here. Good evening, everybody. This is Sherry, and my presentation for you folks is on specialty certifications for family nurse practitioners. So I'm going to be reviewing some of the wide variety of specialty certifications that are available for us to pursue after we take the boards and become FNPs and get some time under our belt practicing in a specialty. Then we can earn certification in that field if we choose to. This was a surprising fact for me to learn, actually, to come across in researching for this presentation. So as you can see in the table here, in 2021 was the time of this study, 34% of NPs were working in primary care. So that was a small number. That was less than I expected. But in light of that, it's very likely that many of us will work in specialties at some point in our careers, even if we do begin in primary care. I also found that about 28% of all specialty practices employed advanced practice providers, so NPs and PAs. And that number was actually rising over time. The authors reported. APPs were employed in at least a quarter of the cardiology, OBGYN, dermatology, gastroenterology, and orthopedic surgery practices that they surveyed. Those practices were actually more likely to employ NPs than PAs, which I thought was interesting, with the exception of surgical practices. And employment of NPs in specialty practices actually grew faster compared to PAs, so 33% versus a 20% increase over the study period. In light of those statistics around how likely we are to be practicing in a specialty at some point in our careers, why would we pursue specialty certification? So some of the answers around that are, as you might imagine, it can show that you have enhanced expertise. It can help with career advancement. It looks really good on a resume. It's something, an achievement that you can talk about and show that you have a commitment to the specific field or specialty that you're in, and can lend a certain amount of professional credibility as well. I did find a survey on the value of certification that was done by the Oncology Nurses Certification Corporation just a couple of years ago. And they did a broad survey of their members, and they found that 94% either agreed or strongly agreed that certification enhanced their feelings of personal accomplishment, provided personal satisfaction, validated their specialized knowledge, and that it indicates a strong commitment to the profession and indicates professional growth in a positive way. One interesting caveat that I found, though, and this is important to note if you decide to pursue certification, because some of them can have a significant cost, anywhere from $300 to perhaps just under $1,000 to sit for the exam, depending on the field. So only 37% did agree or strongly agree that their certification led to an increase in salary. So that is certainly something to consider if you decide to pursue certification at some point in your career. Like I said earlier, there are a wide variety of certifications that you can pursue in different specialties, and I tried in this presentation to just sort of touch on some of the more common ones. So I'm just going to kind of, for each one, we'll go through and talk about who offers the certification, what the credential is, and I provided a link on each slide for where you can find more information. And we'll talk a little bit about some of the practice requirements before you can sit for the exam. And in each of these cases, there is an exam that you do need to sit for, similar to a board exam. So we'll start with the ONCC, the Oncology Nursing Certification Corporation, offers the Advanced Oncology Certified NP credential, or AOCNP. You do need to have an active license and a graduate degree, a master's degree in nursing, or PAs can qualify to take this exam as well, I believe. But you do have to have 1,000 hours of practice as an adult oncology nurse practitioner within the past 5 years in order to apply for certification with them. Did find a few different options in the cardiology world. So there is the American Board of Cardiovascular Medicine offers the Cardiovascular Nurse Practitioner credential, or CVNP-BC. You do need to have 2 years experience in cardiology. It is preferred but not required to have been a cardiac registered nurse before becoming an NP or PA. So that one has a little bit less than, I would say, the average practice requirement before being able to sit for that exam. The American College of Cardiology offers Certified Cardiovascular Knowledge Examination, and the credential that you can sign with after you sit for that exam is CCK. And you do have to have 2,000 hours in cardiac care over the previous 3 years in order to sit for that exam. Interestingly, if you do earn that credential, you can also upgrade your membership in the American College of Cardiology and use the credential AACC, which is Associate of the American College of Cardiology. And they, advertise on their website that this signals to patients and peers that the recipient holds advanced training, education, and commitment to quality. And you do have to spend the majority of your professional time in the cardiovascular field. So you can qualify for the AACC after completing the CCK credential, or there are some other nationally recognized board certifications in cardiology that they would accept as well. But these are just a couple of the options. There are certainly more if you wanted to do a little internet search. That are working in diabetes care. There is the Certification Board for Diabetes Care and Education, does offer the BC ADM credential, and that credential is currently being transferred from a different organization to the Certification Board for Diabetes Care and Education. So you can read a little bit more about that in this link, and that you could also follow that link to look at the certification requirements. You need to have 500 clinical practice hours within 48 months prior to applying for the examination. And in my reading through the website, it looks like NPs that do work in primary care or as PCPs and take care of a significant proportion of patients with diabetes could also qualify to sit for this exam. You don't necessarily need to be working in endocrinology, for example. The Ostomy and Continence Nursing Certification Board is one that some of us may be a little bit more familiar with. I think most of us have had during our time working as nurses, perhaps in the hospital. You've had some contact with the wound care nurse. So this organization actually offers 3 separate certifications. One is the CWCN, Certified Wound Care Nurse, and then the AP is for Advanced Practice. There's Certified Ostomy Care Nurse and Certified Continence Care Nurse as well. Or you could pursue all 3 and earn the CWOCN, which is Certified Wound, Ostomy, and Continence Nurse. It's the tri-specialty certification. And their education pathway does require, quite a commitment. You do need to complete a wound, ostomy, and continence nursing education program that is accredited by the organization. And you are required to successfully complete the exams, sit for the exams, and pass them within 5 years of graduation from one of those programs. And then within each specialty for which you are seeking certification, so wound, ostomy, or continence, you do need 50 contact hours or an equivalent in college coursework after your bachelor's. And you also need to have 1,500 practice hours in that certification specialty as well, with 375 of those hours occurring within a year prior to application. So if this is something you are interested in, you would absolutely need to plan ahead and make this a focus of your practice. And this is quite a significant certification term if you do decide to pursue that, but certainly a need for nurses with those skills, or nurse practitioners with those skills. The Hospice and Palliative Nurses Association, or the HPNA, does offer the Advanced Certified Hospice and Palliative Nurse certification, ACHPN. This is for NPs or FNPs interested in end-of-life care. It recognizes that you're prepared to manage palliative and hospice care for patients with life-limiting illnesses. And you do need to be functioning as an NP within the hospice and palliative advanced nursing practice space with 500 hours in the most recent 12 months or 1,000 hours in the most recent 24 months of practice prior to applying for the exam. The Dermatology Nurse Practitioner Certification Board offers the DCNP, or Dermatology Certified Nurse Practitioner credential. Once you earn that, it's valid for a period of 3 years, and you can recertify either through contact hours of continuing education or by sitting for the exam again. You do need to earn or to accumulate 3,000 hours of recent dermatology NP practice over the course of 3 years and be currently practicing in dermatology in order to sit for this exam and earn this credential. But that is a possibility if you are able to find your way into that very competitive market. The Nephrology Nursing Certification Commission offers the CNNNP credential. For this one, you do have to have a minimum of both 2,000 hours and 2 years as a nurse practitioner practicing in nephrology within the 2 years prior to submitting your application. And you also must have completed 20 contact hours of approved continuing education in nephrology within those 2 years as well. But this is a specialty that's always sort of fascinated me, and it's just really cool to know that the option is there in the future if any of us wanted to pursue it. To wrap up the presentation, we will end with the primary care related certifications. So these are 3 that you could potentially earn while working as a PCP, depending on your interests and the population of patients that you're seeing. So the first is geriatric certification, which gives the credential of GSC, Gerontological Specialist Certified. I was actually made aware of this certification by my current preceptor, Alex Beggs, who we met when he came in to teach our cardiology unit. And he is certified in geriatrics and is able to see patients for consults, which has been really neat to see during my clinical rotation. And so this certification focuses on the care of older adults, covering areas such as aging, chronic conditions, medication management, end-of-life care, and geriatric syndromes, especially including dementia care. That is one of the focuses for folks with this geriatric certification. You do need to complete 2,500 professional practice hours as an APRN working with older adults within the last 5 years in order to qualify to take this exam. The second category would be functional medicine, or the FMCPM credential. This is offered by the Institute for Functional Medicine, and you do need to complete a minimum of 100 hours of accredited functional medicine education and training that align with the competencies of the organization. So I did include that link here as well, so you can review that. Functional medicine is sort of a specialty that takes elements of Western medicine, can combine some more holistic medical practices, but in general, the focus is on finding the root cause of disease processes and addressing those versus focusing solely on symptom management. And then Addictions Nursing Certifications Board offers the CARN AP. So nurses can earn the CARN and nurse practitioners can earn the AP designation as well. You do need to have a minimum of 500 supervised hours in addictions and 1,500 hours of nursing experience in addiction as an advanced practice nurse over the last 3 years to qualify for this certification. So thank you very much for clicking through and listening to my presentation, and I hope that there may be one or two of these certifications that might interest you, or if none of these sort of spark your interest, there may be just the idea of certification in general. Might be something that you hadn't thought of and might be interested in pursuing down the road. If you find something that you really click with and you enjoy it, I think it'll make our years ahead as nurse practitioners much more fulfilling if we can find where we truly fit. I wish you all the best, and it's been a great 3 years with you all. Thank you.